Hello, my name is Signe, and this presentation gives a brief overview of the Academy in Nutrition Dietetics Code of Ethics. To provide some background on the Academy of Nutrition and Dietetics, abbreviated as ANN, formerly known as the American Dietetic Association. It was founded by women in 1917. It was under the government and during World War I, and its purpose was to conserve food and address public health issues such as malnutrition. The credentialing agency that coincides with the Academy is called the Commission of Dietetic Registration, the CDR. This is that exam that you would take at the end of getting a verification statement to get those credentials of a registered dietitian. And both these entities work together to create the Code of Ethics. The vision of the Academy of Nutrition and Dietetics is a world where all people thrive through the transformative power of food and nutrition, and their mission is accelerate improvements in global health and well-being through food and nutrition. Although the Academy was founded in 1917, very early on, a code of ethics that they abided by was not until the 80s. The first really known codes that were created are ethical guidelines, perhaps, was found in 1930. It was called a professional code for the hospital dietitian. Second one was in 1971, Guidelines for Professional Conduct. And then there was the Dietitian's Oath in 1977. And then a couple years later, the Code of Ethics was founded. It's the first formal one, and it is overseen by the Academy Board of Directors, part of ANT, and then again, the Commission of Dietetic Registration Board. And these elects are reselected every 3 years. They kind of just oversee situations that may happen and are kind of the ones that ensure that our profession abides by these code of ethics. And it's important to know that this code applies to all members of ANT, or it applies to individuals with those CDR credentials. So you could be a registered dietitian, but not necessarily part of ANT. And you could be part of AND, but not have those credentials. So it covers nutrition and dietetic professionals. As of 2024, this is the current version and what it looks like, just to give you some eyes on what this PDF looks like. You can find it on their website. It was last revised in 2018, which was mentioned on the previous slide, but it goes through revisions every so often if a conflict arises or if there is a gap identified, such as conflict of interest, especially with social media and language and just cultural humility in general. So here is a great graphic. It is on the PDF, but the current code foundational components of 2018, it consists of a preamble, just essentially introducing the Academy, its purpose, its goals, and what the core values are, which are an individual focus, integrity, innovation, social responsibility, and diversity. Then there are 4 principles: the non-maleficence, autonomy, beneficence, and justice. And then within these principles, there are standards. For each principle, I'm just going to essentially give you all a definition. So non-maleficence, it's to do no harm to the patient. And you might be thinking, how is this different from beneficence? Well, non-maleficence is a consistent thing in practice. It's the consistent risk assessment as the status of the patient changes. For beneficence, it's kind of like in that moment, how can we rank what we're going to do? But we'll go over that when we get there. So a treatment that does more harm than good should not be considered. And also, again, that consistency. Consider the changes in the patient's status, their desires, and such. Now, there are 8 standards that are umbrellaed underneath non-maleficence. I kind of essentially summarize them, but you can see there's not 8 bullet points on here. I just wanted to give you just a brief overview. So in general, non-maleficence is demonstrating that competency and professionalism in practice. You always want to consider evidence-based practice and decisions. That is very ethical, the most ethical considered thing you could do. And also consider the unique circumstances of your client and their community. Also, continuous education, a big component of this. It just demonstrates your competence, you're willing to learn, and your contributions to the field to generate research and questions to enhance the practice, to acknowledge that what was known in the past may not be the same in the future, and how things are changing and how we need to adapt. Then also having the ability to assess validity and the applicability of the evidence-based recommendations, and how they pertain to the patient and situation at hand. They may not always be suitable for the patient or the situation due to different circumstances, such as like financial restraints, maybe their religion, or their desire. So again, one of the core values of the preamble is that individual focus, and always make assessments despite personal biases. Do not let biases come in. What worked for a patient in the past that you did and you were super proud of may not work for the next patient. And also remain in your scope of practice. You may be very knowledgeable in a different area, but it is not in your place to make decisions in that area. So always seek collaboration. Collaboration is great because you can educate your peers as well and work as a team. Seek advice, seek counseling, and also have every chance you can to make those referrals. We want the patient to be their best selves. And again, respect for all and all identities is under non-maleficence. Our next core principle is autonomy. This is self-governance, self-determination, and the capacity to make an educated and uncoerced decision for oneself, organization, or practice. Essentially, it is our moral independence and a self-directed freedom, and this pertains to the patient, an organization, and a practice. Autonomy, this principle contains 9 standards, and again, right and self-determination, organizational behaviors, and practice. The first standard essentially just says respect for the patient's autonomy, and for protecting their personal information and their confidentiality, making sure that if they have information about themselves, especially if they're over 18, they're adults, no one really needs to know. It's a little different situation with minorities. And then disclosure, and then refraining from accepting gifts and services, especially from those outside companies who want you to promote them. This is especially big in nutrition and social media. It's a big money-making thing. It just kind of it reduces the trust that your patient may have in you, and it's a conflict of interest because those gifts, those services may not be evidence-backed. It may be nice to have them and they may make you feel good, but it's not essentially something we should be recommending to patients just because our anecdotal evidence. So yeah, use our professional judgment as well. So if something looks a little suspicious or like someone wants to collaborate with you outside of your practice or whatever field you decide to go in, just use your professional judgment and think about how it may look in a professional setting or in a person's view of you outside of everything else. Then maintain appropriate state licensure and certifications. There are a couple states that don't require licensure, but always making sure that you're keeping up with your CPUs and maintaining your certification. Respect intellectual property. Remember, plagiarism, citations, like making sure that you respect others and their hard work that they put in and their research, reporting inappropriate behavior in treatment. So if you're in practice with another nutrition or dietetics professional and then something is just very unsettling, make sure that you are reporting this or just making a note of it and providing some sort of evidence if you wanted to take this to a next level, such as to the board. So, this could be, for example, coercion, making a patient feel like this is the treatment they have to do, this is going to make them feel better. That pressure, that's kind of not giving that patient that right in their self determination and making them feel like they need to do it. And then documentation, coding, and billing accurately is super important. Um, Patients can see their chart notes, so being very accurate in that. Coding implicates insurance coverage and billing as well. So this one can have financial and personal implications on our patients. So just making sure that we are careful in those situations. Beneficence is our third principle. It's beyond doing no harm and encouraging the active decision to help others in consideration of the individual circumstance of the patient. So it's considering all the valid treatment options, reaching far out to the most extreme, to the less extreme, most invasive to the least invasive, and listing them in preferential order, ideally with the patient. The third principle is beneficence. Under this, there are 9 standards, again, summarized, but this is essentially professionalism in the practice when we're particularly making clinical decisions or non clinical. And this means the respect of the values, the rights, the constructive dialogue, and civility of the individual. And this is across various platforms such as social media and again, and in clinical practice. Again, communication is very important with our patients when demonstrating beneficence. Being aware of our ward choice, the chart notes, the health literacy of the individual, and then providing objective evaluation and upholding professional boundaries is another one mentioned underneath this principle. We want to try to avoid those personal biases, such as inappropriate relationships in the workplace. Honesty and integrity of information, so refraining from having false, misleading, and deceptive claims. This is coinciding with conflicts of interest that may blur our professional judgment. And then the advocacy and contributions to the competency of our interdisciplinary team is very important underneath this principle. Justice is the last principle. It means the fair, appropriate, and equitable treatment and allocation of resources. It's the idea of when we're making a decision, is it ethical, is it fair, and is it compatible with the law and the individual's rights? Underneath this principle, there are 6 standards. In a sense, it's our social responsibility for local, regional, national, global nutrition and well-being, as demonstrated in the mission and vision of the Academy of Nutrition and Dietetics. We should try to aim to reduce health disparities as professionals and help our patients in any way we can, in any form. Provide fair and equitable care to all, no matter what identity or what circumstance they are in or come from. Contribution and involvement in professional development and community service is another standard. We want to promote the respect, integrity, and competence of our profession. Then we want to advocate and promote the uniqueness of the profession because we are nutrition professionals. There's not a lot of education in this area in other medical professionals and not a lot of knowledge known since it's kind of a newer science. And then we want to seek leadership in community positions to enhance the diversity of services that our profession can play in. then with our aim to enhance health and nutritional status in public health. We want to protect the public, we want to reduce disparities and enhance the trust in the public in the profession. Here are some closing remarks. Science-based decisions derived from the best available research and evidence are the underpinnings of ethical conduct in practice. This was taken from the code and is something we should always keep in mind as professionals as we continue and navigate through our career, and as we want to respect the autonomy and make the best decisions and provide justice to our patients. We want to keep in mind as an Academy member and or accepting and maintaining CDR credentials, we agree and abide by this code. And continuing professional educations regarding ethics are required if you are a registered dietitian. So it's always good to keep yourself updated and informed and on the lookout for how you can better your practice in an ethical and supportive way for your patients and clients. Thank you.